ADHD is a neurological condition that affects 3 to 5% of school-aged children. This condition is 3 times more common in boys than in girls. Of course, all children can sometimes be careless or easily distracted or even a little hyperactive. But in children with ADHD, it's more than that. It has a significant impact on at least 2 core areas of the child's life. For example, his life at school, at home, with friends, and so on. As the name suggests, children affected by ADHD have problems with their attention. This can be seen, for example, in the difficulty they have maintaining their attention over a moderately long period of time, and it can be seen in the difficulty they have in ignoring distractors or irrelevant information. The teacher might tell you, for example, that she has to repeat things for your child or help him refocus on the task at hand. The child may also have difficulty dividing his attention and not be able to focus on more than one thing at a time. For example, taking notes while a teacher is lecturing can be a major challenge. An attention deficit can also be present without the hyperactivity component, and when that happens, some people may tell you your child is easily distracted and whimsical, but he or she might not be so agitated. Instead, the child with ADHD has a high motor restlessness. He can stand during class, move on his chair a lot, and tend to grab and play with any object in front of him. Finally, impulsivity can also be found in many of these children. They may, for example, have difficulty waiting for their turn and tend to interrupt. They have a hard time raising their hand before speaking in class, and they just throw out some often random answer before the question has been completely expressed. They may also tend to begin a task before all instructions are given and not take enough time to come up with a plan of action before they start working on a project. ADHD children also tend to have organization and planning difficulties. You may have noticed that your child often loses his belongings or forgets his things at school. When doing homework, you'll notice that he may not have noted the assignments that he has to complete in his agenda, or maybe he brought the wrong book home. In class, your child's desk is probably disorganized, and the material he needs to work may often not be in the right place. All these difficulties, which are more or less present depending on the child's profile, reflect an attention deficit disorder. It's also not uncommon that other problems are present with the ADHD, and that could include, for example, opposition, anxiety, sleep problems, and even learning difficulties. As a parent, you want to put in place the conditions that will allow your child to fulfill his full potential. If you recognize some of the behaviors I've described, it may be relevant to consult and to get a proper assessment of your child's cognitive and attentional profile in order to clearly identify what would be helpful for him. Although medication is sometimes recommended, it's not the only way to intervene. There are in fact many strategies that can be implemented at school and at home to improve your child's functioning.